kind of tell us something's going on focally. And so kind of the big thing that we did a seizure survey back in 2010. It was published a couple years ago, actually 2013. And some of you that were listening may have taken part, if so, thank you. But we actually got 95 responses from families, which is great. It's the biggest the biggest survey that anyone had done so far. And of those 95, 83 had isodencentric and with 63% reporting seizures, 81% with multiple seizure types, and 42% of those that had seizures having spasms. So with this study, though, there's always some bias. So most people, there's it was open to anybody for people just kind of to write in and say that their kids or family members didn't have seizures, but there's going to be a little bit of a bias to people whose family members had seizures to fill it out. So that 63 is probably a little bit high. Most reports are around 50% or maybe 50 to 60, so that may be slightly elevated from what we really see. But kind of getting back to the focal seizures, in this study it was 40% of people with isodencentric, and again it might even be higher with the people with more severe seizure types, more likely to fill out the survey. But 40% with those with not of the whole population, but of those only with seizures had focal seizures. And really with focal seizures, it depends on what part of the brain it comes from. The most common thing is just kind of staring, and you might see some chewing behaviors or some blinking behaviors. Really easy to confuse for an absence seizure. But depending what part of the brain is, if it's in the temporal lobe, some people may say that they get a sensation of fear or a strange smell, because that's what that part of the brain does. If it's in the back of the brain, what we call the occipital, you could sometimes get these weird visual changes because that's the vision part of the brain. So depending on what part of the brain is affected, that's what happened. If it's in the frontal or the central region, that's where your motor area is. That's the part of the brain that helps you move. So you can get some shaking, but it would just be like one arm and one leg, or your arm and your face on that side. So again, just coming from one part of the brain, and then depending what part of the brain it's from is what kind of symptoms you get. Now the generalized seizures, most of the kids that responded to the survey had generalized seizures of some type, and 81% overall that responded to the survey had multiple seizure types. So the other biggies are tonic-clonic, tonic, myoclonic, atonic, and absence, and I'll kind of go one by one through those. So generalized tonic-clonic, that's what most people call grand mal seizures. So kind of what most people think about when they hear seizure. It's kind of head back, shaking of all four extremities, drooling, sometimes eyes rolled back. And the reason it's called tonic-clonic is the tonic is the stiffening part, and then the clonic is the shaking part. And if anyone has a seizure like this, you're going to be tired afterwards. We call that postictal. It kind of just means after seizure. So there's usually fatigue, confusion, and the longer the seizure, the longer the fatigue afterwards. So sometimes tonic-clonic seizures can be, 10 seconds. Sometimes they can be an hour. Most seizures last 2 to 3 minutes, or 1 to 3 minutes. So seizures more than 3 minutes are rare. Seizures less than a minute are less common, but sometimes we see really short versions of these, which is, the shorter the better. And then atonic seizures. So these are called drop seizures, is kind of the more kind of famous name. So atonic just means no tone. And so the most common is head drop. So just kind of a quick drop of the head straight down, no movements of the arms, the shoulders, just a quick loss of tone in the head, and just kind of drops forward. But if it's more severe, it can be a whole body drop. So sometimes kids, their whole body can drop down, but more commonly they're milder than just the head. But if they get severe enough, the kids can their whole body can drop to the floor. And then tonic seizures are kind of like the tonic-clonic, but without the shaking part. So it's just stiffening, and it's usually several seconds. It's usually not more than typically it's 5-10 seconds, but it can be as long as half a minute or a minute, rarely. But these seizures tend not to go very long at all. The vast majority are a minute or less. But tonic seizures are tougher to treat, and they're the one seizure type that if you see tonic seizures, it's going to kind of indicate that the whole epilepsy in general is going to be harder to treat. Typically focal seizures, head drops, and sometimes those aren't so bad. When tonic seizures get involved, then it usually becomes a little bit trickier to treat the whole epilepsy in general. Myoclonic seizures are a little less common, but we still see them. So very brief contractions of muscle groups. So really just a quick jerk of the extremities. So like towards the end of the lecture, if anyone's getting bored and they start nodding off, and then kind of your head goes down, then jerks back up, that's a myoclonic jerk. And we all do it in our sleep. We all have myoclonic. So if you kind of have that dream you're falling, and then you just like that, like, you can feel your whole body just jerk and it wakes you up. That's a myoclonic jerk, but these kids that have myoclonic, that's normal in sleep when having these big episodes of myoclonus during the day. That's what's abnormal when you're wide awake, so those can be myoclonic seizures. And then the absent seizures, there's typical and atypical. In Dup15, the seizures are usually atypical absent. So typical absent seizures are the kind where it's just a quick loss of consciousness, kids are out for a few seconds and pop right back to where they left off. The atypical absent seizures are longer. Kids can be partially aware, so if they're like walking across the street, they can just kind of keep still walking across the street. Sometimes they can respond a little bit. And those are the kinds that are seen in the kind of mixed seizure disorders such as 15q. And then infantile spasms. So really you can get spasms at any age.